This brings us to the discussion of premium excimer laser technologies and how they differ from the traditional modes of treatment discussed to this point. To begin with, some background on the diagnostic component known as wavefront is necessary. Wavefront was originally developed for use in high-power telescopes to reduce distortions in space. First, a narrow ray of eye-safe infrared laser light is passed into the eye and directed to the retina. The light is then reflected off the retina, passes back through the lens and cornea, where it is collected and analyzed for optical distortion and deviations from the ideal. The computer then creates a fingerprint of vision, a map of irregularities inherent and unique to your visual system. This technology uncovers specific characteristics of your optical system never measured before using standard methods for glasses and contacts. To create the treatment plan, your visual fingerprint is compared to an ideal wavefront map, and the computer designs a personalized treatment plan that is specific to your own visual needs. Wavefront technology is therefore groundbreaking because it has the potential to improve not only how much one can see in terms of visual testing on the eye chart, but also how well one can see in terms of visual quality. Treatment of visual nuances should translate into a reduced risk of post-LASIK side effects, such as glare, halos, and difficulty with night vision. And this is exactly what happened. With the acquisition of custom LASIK technology at our center in the summer of 2003, we began to observe a statistically significant improvement in our patients' visual outcomes when compared with traditional treatments. About 6 months following the introduction of custom technology in the U.S., the FDA granted approval to an even newer generation laser system called the Allegretto. Produced by Wavelight AG of Germany, it also employs wavefront technology in its treatment planning and has one of the fastest delivery systems available in the world. In December of 2003, Millennium became the first center in the United States outside of the 10-center investigational group to obtain this amazing device. At that time, custom treatments were only approved and available for use in low to moderate myopia. Our acquisition of the Allegretto gave us the ability to treat higher myopes, hyperopes, and patients with astigmatism with this new device that promised to deliver custom-like outcomes. The results in patient satisfaction levels were amazing. And then something curious was observed. When we analyzed the outcome data of several hundred patients with low to moderate myopia treated on the Allegretto system, we noticed that the outcomes were even slightly better than those in our custom LASIK group. With its smaller beam profile, more laser pulses are required to sculpt the tissue for any given treatment. However, it operates 3 to 10 times faster and more efficiently than any other laser available in the U.S., treating up to 1 diopter of prescription every 4 seconds. This rapid treatment delivery, guided by its incredibly precise active eye tracking system, translates into tighter control of corneal hydration in our environmentally controlled laser suites. This in turn improves the accuracy and predictability of outcomes. The wavefront optimized Allegretto laser also effectively treats patients with larger pupils. Its larger diameter treatments cover the pupil better and help to minimize glare, halos, and other night vision problems that some patients treated with traditional LASIK experience. The larger diameter treatments of the Allegretto also seem to produce better visual outcomes, and in retrospect, may be one reason why custom LASIK treatment outcomes were better than the smaller zone treatment capabilities of traditional LASIK. While wavefront guided procedures may be invaluable to those patients with very small prescriptions who are bothered by more subtle visual irregularities, closer analysis of custom treatments show that very little customization is taking place in patients with higher prescriptions, where nuances of vision are not the main problem. At Millennium, we are committed to staying ahead of the curve by investing in technologies that will provide you the best visual outcomes possible. Since the introduction of custom and the Allegretto at our center, we have seen our treatment results and levels of patient satisfaction improve to levels that would have just a few years ago seemed unimaginable. In the past, we were happy if our patients could see as well or almost as well as they did with corrective eyewear prior to their procedure. Now, with the use of these premium technologies, more than 50% of the patients report to us by the very next day that their vision is already better than it ever was with glasses or contact lenses. Although we have both custom and traditional LASIK and microkeratome capabilities available at our center, currently the speed and accuracy of the Allegretto, in combination with the safety of interlays for flap creation, is our primary treatment of choice. During your consultation, we would be more than happy to share our outcome statistics with you for patients with similar prescriptions treated on these different laser platforms to help you to better understand our recommendation if you feel that this